I think that only with the without the tiotrope correction with filler, the only with the anteromedial cheek area looking more lifting, and the tiotrope looking more a little bit more improved by the direct effect, indirect effect, I think. But to make a little bit more the complete result, I had to perform the tiotrope correction. The lip to eyebrow, okay. I love to use the tiotrope correction in first treatment cases. I love to use the cannula. As I told you in my lecture, that about 20% or the 12% of the patient is about the deep facial arteries along the tiotrope, and some all the patient of the angular vein, but and all the patient of the infraorbital range of also here. So I love to use if we inject deep area, a cannula will be much better, I think. So the lip to eyebrow, please. This is the make entry point. Okay, 25 gauge needle. Okay. Then please give me the yes. It depends on your choice, but in our Asian person is a relatively thick skin. The target area is a SUF. This SUF means a deep substance area between the superior orbital retaining ligaments and the tiotrope ligaments. So this is the SUF area, is our target depth. And bilateral balance can be another option. But in case of very thin skin and in case of the very over mid-aged woman, the deep injection with bilateral soft will be much better, I think. But for this patient, I would perform the two-layer technique: deep medial soup with bilateral vellus and the subdermal vein tiny injection with the bilateral soft. Okay. Close your eyes. Gently proceeding to the deep area behind the muscle. Okay. This is my eye. This left second finger with the non-dominant is my eye. And I can feel the margin of the cannula. And we had better avoid above the infraorbital rim not to inject to the orbital space. And very regurging.
Okay, so most of the time, how much of the volume you inject per one teardrop?
Tiny amount. It depends on the case, but the minimum within the 0.2 ml, one for the treatment session. And the strong point of the cannula is we can perform not only the teardrop like this, turn the direction of the cannula, and hold the margin of the infraorbital rim like this.
Do you experience like injecting teardrop and then it looks pretty for a while, and then after the patient come back for follow-up, after 2 weeks or a month, it start to get a sausage form?
Yes, this is a very important for the teardrop correction. That is why that's the main reason of that region is the time of the swelling, because a little bit more higher binding capacity of the water binding capacity. So we had to better choose the filler. The injection amount is very sustained, good, not higher water binding capacity like this. Then especially for the over mid-aged woman, even if we inject behind the muscle, but 1 or 2 or 3 months later, we sometimes look more swelling and sometimes are a little bit more tender effect, because mainly due to the aging process of the orbicularis oculi muscle is a descent problem by aging process, and gap formation may cause. So if we gap formation, even if we inject behind the muscle, some material is protruding the superficially. That is another problem.
Okay. So are you done with the teardrop?
Okay, then please give me the very tiny amount of subdermal injection with the
Soft?
Belotero soft.
Belotero soft, sharp
20
or cannula?
27 gauge cannula.
Okay.
Okay.
Soft 27.
Rangsima,
Yes.
I think Neve has some comments also for the teardrop, why V sausage thing appears once
Yes,
in a while.
please.
Yeah?
Go ahead.
Yeah, the anatomy of the lymphatics has been published last year, and there is two main lymphatic systems only, two trunks. One is medial and one is lateral, and it cuts through the muscle. And the trouble is when you're injecting
Almost finished.
the tear trough, and especially laterally the palpebromalar groove, you can block those lymphatics, and I think that is very much part of it. We've certainly seen that surgically, but also the same thing will happen with your, if you get any pressure from your cannula, or if you're putting hyaluronic acids into the tear trough area medially, suborbicularis. So that, I think that is a major component. So I would beware going too medially, stay more centrally when you're injecting. You're less likely to get problems.
I see. So if that kind of problems caused from lymphatic, which means Hyaluronic will have less effects in the treatment?
No, I think it's, well, I'm only hypothesizing. I don't know. But I know that the lymphatics, and I've seen the dissections that have been done, and I mean, I went, wow, I must be putting pressure on my lymphatics every time I did a tear trough. No wonder I was getting swelling. So I think if you stay more centrally, you're going to avoid the pressure effect on those lymphatics. They're too small. You're not going to inject filler down the lymphatic. It's too small. It's a pressure effect.
Okay.
And remember, lymphatics are so easily squashed. They don't have any muscle in their wall. They're very, very thin and easily flattened.
But anyway, tomorrow we will also have hands-on session with JY.
Okay, almost finished it only with the deep injection. I think that the tear trough looking more improved state,
ขอหน้าคนไข้
but
ตรง
a little bit more
Okay.
the
Wait.
smooth
Wait.
reduction.
Let me เงยหน้าขึ้นนิดนึงค่ะ
Okay,
Yes,
okay, the before and after the procedure.
Okay.
Lift your chin, please. I would perform the very tiny amount.
So inject subdermally.
Yes.
And I love this technique too, but I use larger of the cannula though because I'm scared of poking into the
Yes.
vessels.
Close your eyes,
หลั
please.
บตานะคะ
But sometimes, especially for the over mid-aged world woman, this area looking very tight because from the tear trough rear ligaments, some the ligament tissue, the tethering to the skin, and very hard tissue. So we had very make a gentle subcision to loosening the tether ligament tissue and the injection again.
Okay, so you can see he's going to the very superficial subdermally plane. So you can see the tip of the cannula when he angle it up. Okay, and retrograding injections.
Yes. We always keep in mind that in this subdermal injection is very soft, like very good tissue integration material is needed, and especially more beneficial to the a little bit more the mild or moderate fat pad prolapse or the infraorbital a little more low eyelid redundant
Okay.
case like this.
Okay, ลืมตาขึ้นด้านบนนิดนึงค่ะ
Okay.
Okay, ล่างหลังตรงนิดนึง You're done now?
Yes, I
Okay.
put the subdermal addition 0.15 ml with
Okay,
Belotero
เงยหน้า
soft.
ขึ้นนิด So you can see from this that we feel the defects already very nicely. Okay, ก้มหน้าลงนิดนึง And this is the side that what we treated. เดี๋ยวนะต้องทำหัวตรงมองหน้าตรง Okay. I think we'll take questions from now.
Yeah.
Before we finish the other side, so I can have lunch together with you.
We have actually we actually went on time after starting late. So
Yeah,
I
you know,
think
because I'm very good at timekeeping, and tomorrow I will just like.
I try to as fast as possible.
yeah.
No, you are always very
Okay,
fast.
and then the other side next year.
Yeah. No, we cannot do that. Okay, so any
Questions?
questions? I think it's really just very, very clear from the floor here, and everybody is
Hungry.
hungry.
Me too.
So
We'll take like 5 minutes and then we'll finish.
they were not
Enjoy.
even aware that we caught the coffee break. The coffee and
Why
the...
don't you apply to our volunteer?
Yeah.
Yes, thank you very much. All right, so thank you, Dr. Park, Dr. Rong Sima. I think we wrap up for this, and we will have lunch for now.
Okay.
All right.
Thank you very much. Thank you.